let's think about not an athlete, but let's think about someone comes into clinic in private practice, okay, who maybe a lady who's been reasonably fit in her early years. She's got married, had children, and become a little bit deconditioned, and then tries to start running again to get fit. And of course, I think that's probably one of the biggest no-nos for me in terms of the development of, say, lateral gluteal tendon pain, because they are deconditioned and they're trying to do a really high-load dynamic activity. There's nothing wrong with doing a high-load dynamic activity, but just prepare yourself first for it. So perhaps integrate into a Pilates class, get a little bit of inherent stability and things like that to basically before you start to do that activity. Because what you tend to find is, it's like Shirley Sahrmann, years ago I sat and listened to her talk to me about the body takes a path of least resistance. And I just had someone this morning, a new patient who's a golfer. He's a very fit man for his age. He came in, he has pain in his back, and it's quite apparent he's got degeneration in bilateral hips. So of course he's got a flexion, a lumbar spine flexion issue. Okay, he's got some wear and tear in the lower back. He's got disc degeneration because he used to be a parachute instructor many years ago, and so with all the jumps and the impact, that's probably had some impact on it. He's had a scan on it. But classically, okay, when you look at spinal movements, okay, he's going to restrict it in flexion, you're going to get extension hinging, okay, with increased translation into extension. Side bend and rotation is going to be limited. And of course, when you look at the movement of hip flexion and seated, as he lifts his hip into flexion, it's limited to a certain point, but it moves externally into lateral rotation or external rotation. That's the body taking a path of least resistance. There's obviously some degenerative changes in that acetabulum or the femoral head. So when it comes to a certain point, it abuts against the structure, and it has to find a way to get around that. And that's exactly the same with the patients with the low back SIJ pain, because they keep overstretching in those scenarios.